Good morning everyone, I am Dari and my team is here to present the Ise activity under the course Statistics, Probability and Physiologics. It is a case study on heart disease prediction using one sample t-test. In this presentation, we will be starting with the introduction and problem statement. After that, we will be discussing on theory and how the methods are used. And in the end, we will be discussing the result and evidence. Why heart disease matters? In the total death that happen in the world, 32% of global deaths are caused. In the total deaths that happen in an annual year, 32% of global deaths are caused due to cardiovascular diseases. The data set which we have used is from Canada and it has a total of 125 patients So, according to WHO, World Health Organization, they have mentioned that 122 millimeter of mercury is the normal blood level, and when the blood pressure exceeds from 122 millimeter of mercury, it has a high risk of heart diseases. So, we have a question. Can we use statistics in predicting heart diseases? That is what we are discussing right now. The data set which we have used is heart disease data set from Canada, and it has a total patients of 125. It has 14 clinical features that are mentioned, and in that data set that we have used, heart disease patients who have heart disease are 526 and 499 patients are without heart disease. The data set have an average age of 54 years, and the gender, mainly males are the persons who gets heart diseases easily. 68% of males are affected by heart diseases. And the test variable focused is test BTS, which is resting blood pressure.
So I am going to proceed further on with this presentation on heart disease prediction. So this was the overview of the data set. Moving forward, the functionality, methodology, and what actually we are going to do. We will move to this slide later on. First, let's know why we are actually using one sample t-test. Now, as I told you before, that this data is actually, we are comparing this one single data from a sample population mean of blood pressure, that is 120 millimeter Hg. That is set by WHO standards, right? So that's why we are not comparing here two different data. We are comparing one single data to one sample of population mean. That's why we are going to use one sample t-test. That's as it is written here. Single sample versus fixed standard. One patient group compared against WHO's 120 mmHg. The scenario this test is built for. Now, another reason we are using one sample t-test is, as we are looking here, the sample n is 20. You can notice when the sample is less than 30, we usually use one sample t-test, and that's the most optimal way to calculate our hypothesis testing. That's why t-distribution is preferred over z-distribution for small sample. So this was another reason why we prefer one sample t-test. Now, another thing is here the population standard deviation is unknown. That's why one sample t-test is very much optimal for us. So only sample standard deviation can be computed. As we know, the standard deviation is unknown. So that's why we are going to use t-test, one sample t-test. Also, the blood pressure that we are calculating is into continuous variable format. Continuous normal variable. Blood pressure is continuous and assumed normally distributed. It is normally distributed. That's why we are going to use one sample t-test. And last but not the least, right tail one time t-test. As we know, the testing of BP, it's not going to exceed a threshold value. The BP is either less than 120 mmHg or it is more than 120 mmHg. So that's the only hypothesis we are testing over here. So that's why these are the 5 reasons why one sample t-test is the best approach for our case WHO normal standard for mu naught, and sample standard deviation and sample size. That is degree of freedom. Degree of freedom as we know n-1, that is 19. Now hypothesis formulation, what exactly we are calculating. So as we know there are two types of hypothesis, null hypothesis and alternative hypothesis. So if our mu is equal to 120 mmHg, that means it is what the optimal blood pressure should be of a normal human value or from the sample size we are calculating. Or if the mu is greater than 120 mmHg, that means the patient shows elevated blood pressure and there are risk of heart disease in that patient. So the test type is our wanted, as I told you earlier. Our alpha value is 0.05 and degree of freedom is 19 and reference, as I told you before, mu naught is 120 mmHg.
So now I continue with the next slide. In next slide we are seeing the calculation breakdown. How the calculation works in the disease prediction. So we are taking the real world problem. The heart disease are causes due to high blood pressure or low blood pressure. So we are taking a data set with the high blood pressure, average blood pressure and low blood pressure, which is the more important in our data set. So we are calculated the mean using the numerator, denominator, calculated value, tabulated value and p-value. In that the calculated value was given as t tabulated, which is because of the we are using the one sample t test, the calculated value which is the sample mean, we are getting that 130.85 and we are calculated the sample mean about the 20 patients and the 120 is the normal blood pressure. If we are taking two hypotheses, one is the null hypothesis, second one was the alternative hypothesis. In null hypothesis, we are taking the assumption that the normal blood pressure was 120, like the average blood pressure is equal to 120. It is the null hypothesis, and alternative hypothesis was the average blood pressure is not equal to and it is greater than the normal blood pressure, which is 120. Then we are calculating the sample mean, standard deviation, which is 18.97, using the sample size n is of 20 and the reference which is the normal blood pressure was 120. Then the statistical decision that we are calculating the t-tablet calculated value, which is 2.55, using our reference and sample size, which is 20, and then we taking the tabulated value, which is 1.7291. As we see at the result, the t-calculated value is greater than t-tabulated value. We are getting two hypotheses. One is null hypothesis and one is alternative hypothesis. If we seeing that the t-calculated value is greater than the t-tabulated value, then there means the result was at the conclusion the statistically significant difference is given and the hypothesis is rejected. So using the alpha, which is the significant level of significance, which is 0.05, at that time the p value is 0.009622. Reject the hypothesis and accept the hypothesis, which is alternative hypothesis. Then the evidence, which is the dashboard insights. In that we are seeing some graphs. First one was the BP distribution chart, T distribution graph, then the box plot, mean BP comparison. In BP distribution chart, we are getting majority of disease, majority of patients. Using that, we are comparing the heart disease, which is having BP above the reference, like normal blood pressure, which is 120, or one who was having the less BP. Then T distribution graph give us the calculated T value, and it compared with the tabulated T value, and we are getting that the H naught, which is null hypothesis, is rejected. In box plot, we are seeing the median of BP, which is both disease group lies above the 120, which means it having the higher blood pressure, and mean BP comparison. In that we are comparing the mean value